So we're thrilled to have Kathrin Folkendt on today, who's a founder of two companies. She's a tech expert, and she's built Femtech Insider, which is a newsletter and community that really brings together so many of the pieces that inspire us to do this podcast, which is the delivery of care, the availability of care, the companies providing care, the stories that people have that inform the companies they're creating.
So Rachel, I think probably I have the distinction of being one of the only gynecologists who is subscribing to the Femtech Insider newsletter. And think about the transition that's occurring in business right now, where young, smart women who start out in the tech world and then kind of mix their own personal situation with their own women's health and put the two together to really create good for the overwhelming majority of women. Her story is very resonating and really moving. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
Welcome to today's guest, Kathrin Folkendt, who is a serial entrepreneur at this point, who started two businesses, both of which we're going to get into. Welcome, Kathrin. Thanks for being here.
Thank you so much for having me. I'm super looking forward to this conversation.
Well, it's great to get to connect with you again and talk about all the work you're doing. So you came from tech, and now you're launching two businesses, both of which have some tech component, but let's jump into Femtech Insider. What is Femtech Insider, and what have you done to miraculously have such an impact in the short period of time that since you launched this company and the products that are affiliated with it?
Yeah, so Femtech Insider is a platform all about women's health innovation. So what we try to be is really be the go-to source that's kind of connecting the women's health innovation ecosystem. We try to be as up-to-date as possible on everything that's happening in our space. So anything from investments to insights on new research in the women's health space. Lots of talk around the amazing female founders that we have in our space, obviously also. So really, trying to be that go-to platform for the Femtech, for anybody that's really in and around the Femtech ecosystem.
But one of the interesting things you've done is you added a job board, which was a relatively new opportunity in the space. Mm-hmm. What was the catalyst for that, and how is it working in terms of what kind of responses you're getting?
Yeah, so funny thing you mentioned that. So for me, you already mentioned it a little bit. My background was in tech. And so, I've spent my entire career building products and marketing products and designing customer experience for products, mainly in the software as a services and fintech space, actually. And when I was in these jobs, I absolutely enjoyed them. But I always, felt like I really want to do something and work on something that really makes a difference and that really has meaning. And so I stumbled upon the women's health space, actually, and sort of it's somewhat interconnected to what we're going to talk about later with Perla, when I was diagnosed with Pcos, so Polycystic Ovarian Syndrome, a couple of years ago. So I was diagnosed quite late in life, in my early 30s, after struggling with the symptoms, pretty much my entire adult life. So, I had mainly the cosmetic symptoms, so acne, hair in places where you don't necessarily want to have a lot of hair, and also irregular periods. And so here's the thing, I'm Austrian and I have access to actually really, really good healthcare. And yet I was sent away by doctors like all the time who told me, well, this is a cosmetic issue, just, more or less go away and deal with it. And so one of the quite common symptoms of PCOS, or two of them, are actually obesity and also infertility. And so I'd always worked really, really hard to maintain my weight, like worked out a lot, ate super healthily, and so I sort of didn't tick that box. And then I was young enough to not I didn't really want to have children at that point in time. So, I never sort of ticked the infertility box either. And so, it took me a very long time to actually get diagnosed. I was sort of, I decided to get laser hair removal eventually. And I found a flyer in the doctor's office. And it's like, well, this might not work as well if you have like a hormonal condition like PCOS or hirsutism, or, if like kind of the hair growth is coming from other places. And I'm like sitting in the doctor's office and I'm like Googling, right, what is PCOS? And so here's the thing. I was a woman in my 30s at that point. And I was like, how come I have never heard of any of these things? Like, this is like crazy. And so, I, sort of took that pamphlet, took it to my OBGYN and, was diagnosed. But then, as somebody with a tech background, I was like, well, obviously there's a problem. Like, how can I solve this? Like, how come I have never heard of any of these conditions? And how come this is the case? And sort of, whenever you see a problem and you've spent that much time in tech, you always look at the innovation angle and how can you really make a difference.
But was the problem sounds like it was twofold. It was PCOS personally, but it was also this idea of access to information.
Yeah, absolutely.
So I'm going to throw it over to Alyssa. I'm sure you see PCOS patients frequently in your office. Is their experience before they get to you similar to what Kathrin experienced on her journey to a diagnosis?
Yeah, well, sadly, there is that experience. So PCOS, just for people who don't understand it, is a situation where ovulation doesn't occur regularly, if at all, and therefore hormonal imbalances are really quite noticeable, and they show up with symptoms like acne, like hair growth in typically male places, like menstrual irregularities, everything that you're mentioning, Kathrin, that you've had to deal with. I have often wondered, since I do see PCOS in my office very frequently, whether this is something that now is more common, or is it just something that's more commonly diagnosed now because it's on our radar to pick this up. And the issue with PCOS is that it's not easily diagnosed. In other words, we can do blood testing, we do ultrasounds, but the real way to diagnose it is to take a sample of somebody's ovary and put it under the microscope, which of course is a little bit aggressive to make a diagnosis. So I feel for your story, and I think it's amazing that you've considered a company to educate other women who might be dealing with this. Can you tell us a little about how you, what the company is all about for PCOS, how women can navigate this? How do you get people in your community? Fill us in.
Yeah. So I think when it comes to sort of the journey with PCOS across the many years of living with this, it is a chronic condition. There's many different sort of points where women struggle. So the first one is actually, getting diagnosed, and sort of how we're addressing this is really through talking about the symptoms and like kind of creating awareness that, well, if you are struggling with irregular menstruation, maybe you have some other symptoms that could potentially mean you have PCOS. Mm-hmm. So really educating women that are experiencing PCOS symptoms, that they might be PCOS related, and then, kind of getting them diagnosed. I definitely believe that getting diagnosed with PCOS is somewhat this bittersweet moment of like, on the one hand, you're like, well, it's not me, I'm not causing all these things. But on the other hand, it's also like, okay, I have a chronic condition now, so I need to figure out how to deal with this. Obviously, you already mentioned it, the diagnostic process is not very ideal. It definitely, at this point in time, also with the research that we have, you definitely need to have a provider involved in the diagnosis. Like, this is not as simple as, we're often like, yeah, just send people a test kit and then, tell them if they have PCOS or not. It's more complex than this in this case. But we're obviously also, thinking about sort of that diagnostic moment and what that means. It's also a fact that a lot of women, I think based on research, it's around like 70-80% actually leave the doctor's office with no information. Yeah. So it's just like, okay, you have PCOS and now go figure it out. So that's not very satisfying. And considering the many different symptoms there are with PCOS, it's very difficult for women then to sort of navigate and figure out which providers are actually involved in my care with PCOS.
Yeah. You bring up such a good point, because there are so many disciplines that really need to be involved. So of course, at least in the US, I think the OBGYN is the first step for somebody to come with what's usually their first symptom, which is either my periods are a mess or I have acne and my dermatologist told me to come to you. But we also have the dermatologist involved. We have an endocrinologist, a hormone doctor involved. We absolutely need nutritionists involved. Exercise coaches or trainers certainly are part of the picture. And in some cases, mental health specialists, because we do know there's a higher chance of depression and anxiety for women who have been suffering with PCOS. So these are, to me, opportunities for your business to really bring this whole community together with so many different disciplines.
What's fascinating to me about what you've been talking about, and we want to hear about more about the company and what the vision is for it, is not only is it a challenge to get diagnosed, which could take years, and if you are thinking about having a family, potentially interferes with some of those years of opportunity, but that even after the diagnosis, as I heard you say, there's still not a lot of clarity about what to do. So does your company, Perla, that you're creating, and I know that you're still underground and secretly developing it, does it deal with both parts of that, with diagnosis as well as what to do now that you've had this, as you said, bittersweet diagnosis?
Yeah, so I think what we're really looking to do is to create sort of an end-to-end solution that kind of covers everything from, early diagnosis, or well, not early diagnosis, and then sort of kind of helping women right after they have been diagnosed, but then also, going into chronic care. And I think this is really crucial also, with PCOS. The problem may change. So, if I'm diagnosed as a young woman, I might not be struggling or might not be struggling with fertility yet. And, I'm on, usually many women with PCOS are put on birth control and sort of that to kind of alleviate the symptoms a little bit. But, further down the road, I might be struggling with fertility and need different care. There's also a lot of questions that come up, there's so many different symptoms that could potentially be associated to PCOS. So just having a place to go to ask these questions that come up. And I mean, you also mentioned the mental health aspect. So, kind of having somebody to help you through that journey of the many ups and downs of living with a chronic condition, I think is really, really crucial. And also if we get the mental health bit right, then, we also have a higher probability of women being able to stick to different lifestyle interventions that are also often recommended for PCOS.
So here's today's hot flash, which I really think is just vital for people to know, women and anybody who is associated with any women. PCOS is basically an acronym for something called Polycystic Ovarian Syndrome. What is this big mouthful of words? Basically a syndrome that many, many women are suffering from, where ovulation doesn't occur very often. And if it does occur, it's quite irregular. And what does this translate to? It translates into hormonal craziness, where levels of hormones are really all over the place, meaning estrogen, progesterone, and testosterone. And women suffer with clinical symptoms such as really wonky periods, acne, hair growth in typical male places, and also weight troubles, fertility troubles, mental health issues such as depression, and even sexual health issues. So this actually touches most aspects of a woman's life. 1 in 10 women are affected by PCOS. This is big, and so I'm really, really pleased that we're getting more awareness out about this syndrome. I am always surprised to know how many people are affected without really understanding what they're dealing with. I loved on the site that I did look at the glossary of terms for PCOS, because many of them are really unbeknownst to those who are dealing with this.
Have you found in your building of the Femtech Insider community and the building of the Perla PCOS business, I mean, I would imagine you get responses of such gratitude and relief that you're providing these resources. I mean, I know from the business side, I love reading Femtech Insider, and it really is comprehensive. And you really do cover a lot of different aspects. You cover the medical piece, like Alyssa does in her office. You cover the business side, like I spend my day doing, and you really create an intersection of all the important topics. What is the response you've gotten from the femtech, sex tech, women's health, call it what you will, from the community? Because we've continued to organize and establish ourselves as a force. Have you found it to be collaborative?
Yeah, absolutely. And, it's so exciting to see this community growing and, more initiatives popping up. And I really I'm such a strong believer also that a rising tide lifts all boats. And I remember, so my initial moment when I started Femtech Insider was in early 2019. The infamous Frost and Sullivan report had just come out, the $50 billion of femtech industry size number, which I would argue is actually a lot larger. But, back then I was I'd been following the femtech space because of this interest in the intersection of women's health and tech. And at the time I was like, oh, that's so exciting. Where can I go and learn more about this space? And so I've worked for a lot of fintech and SaaS companies. And, it was how come there's thousands of blogs about financial services and the future of finance, and thousands of blogs about different productivity tools and, software as a services. And why is nobody talking about women's health innovation? I mean, something that affects 50% of the humans on this planet. And so, I just really couldn't understand it. So this was kind of my moment of starting Femtech Insider. And ever since, it's been great to just see this space grow and just observe people connecting and, hearing stories of people getting funded because an investor saw them featured on Femtech Insider, etc. So it's just really amazing to see that impact we're having. And it's sometimes I'm just incredibly grateful of all the support we've received from the community. And, I'm incredibly grateful of the work I get to do every day because I can have such an impact. And it's also it feels like I found my mission, both with sort of Femtech Insider and also with Perla Health.
Other than your passion for the PCOS cause, what other startups or femtech type companies have really gotten you rolling? I mean, there are just so many.
Yeah, I mean, it's always super hard to pin it down to one company, but there's a few spaces that I'm really, really incredibly excited about. So, obviously gynecological health, because I work on a PCOS startup. So I'm super excited to see, it's also endometriosis awareness month right now. So, all the startups active in the endometriosis space. I'm incredibly excited about also PMDD. I think needs a lot more done. Fibroids, those are a couple of conditions where I would love to see a lot more startups pop up. I'm incredibly excited about all the innovation that we're seeing in around contraception at the moment. Also, sort of birth control for men, which I do believe is actually part of women's health because it allows us to not take hormonal birth control potentially. If our partners can sort of do that for us. There's so much also conditions maybe that are not sort of specifically women's health, but affect women differently or predominantly. So I think there was some amazing event last week about heart health. I'm always so amazed by the things I get to see and the spaces where women choose to innovate to really make their lives and also the lives of millions of other women better. So it's a great space to be in.
One of the things you're pointing to has become really the narrative in women's health, even more so during COVID. You mentioned a couple of them. One is that things affect women differentially, like COVID. Some diseases affect women predominantly, let's say like breast cancer, and some affect women only, based on the organs that we have and that, men don't have, like ovarian cancer. But what's been exciting for me to watch during COVID is this idea that's birthed very much from the same idea that you talked about PCOS. In order to treat a woman, you have to understand the wholeness of her experience. So it's not just sexual health or mental health or physical health. It's the integration of all those. And even listening to you and Alyssa talk about PCOS, Okay, and it's a dermatologist, and it's an endocrinologist, and it's a gynecologist, and it just the idea that we're having more conversations and bringing awareness to how complex this is and how many different kinds of questions and areas of expertise we need to have, not only from Alyssa's perspective to treat patients, but from your perspective as both an information provider and a patient.
Yeah, no, and I absolutely, I couldn't agree more. And, I'm a huge believer in integrated care and, treating the whole person.
When can we expect to see announcements for what Perola is bringing to the market?
Yeah, so we're currently still, we're talking about the fact that we're working on PCOS, but somewhat still in stealthy mode. We are probably looking at raising around maybe in the early summer. So currently really working on preparing a pilot and generating some evidence and sort of, using that data then to inform our decisions and also kind of go into the fundraise with them.
Super interesting. I can't wait to see whether maybe telehealth is going to be a part of this, or maybe some sort of app to, really with an algorithm to see whether PCOS is affecting you. So I wish you the best of luck with this. And I think it's high time that this particular syndrome gets much more attention.
Totally. And it's also, I'm, so grateful to be able to be on podcasts like yours because, we need to talk about PCOS more. We need to talk about women's health and all these conditions that are stigmatized and not talked about enough more. And yeah, I'm super grateful for this opportunity. I really believe that kind of creating more awareness for all these conditions will eventually lead to more research in these spaces, because unfortunately also we know that, there's a lot of areas within PCOS and within a lot of other women's health conditions where we just don't have the research that we, should have. And also consequently, I think that creating more awareness for these conditions will lead to more funding. And that's really what we need to move this industry forward.
Most definitely. And to have really good information that's valid and credible is most important, because we all know it's the Wild West out there online. So it's great to have reputable sources. So thank you so much for your time and for all the work you're doing.
Thank you so much for having me. It was a pleasure being here.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.